100, and in this particular room, relatively large room, and we've got 16 treatment tables that are here, and in this room we can reconfigure it any way that we need to, and today we had 10 different machines set up around the room with 3 to 4 students per machine working on these particular tests so that they learn how to do them. The tables that are here we use for multiple other courses, and this is where we do hands-on manual therapy, exercise therapy, any number of different therapeutic techniques that we need to lay people down on a table. As physical therapists, the students are going to run into a number of issues with patients that require assessment of the ability of the nerves to function and the muscles that are attached to those nerves to function. And so this is a series of examinations that can be done clinically to assess how well the peripheral nervous system is working, how well the muscular system is working. Well, this is the perfect type of situation to allow them to be both patient and therapist. So they get a chance to experience what it's like to do the different techniques as well as experience what it feels like to be on the receiving end of the techniques. We want to make sure that the students go out with some modicum of ability to do many of these techniques that we use so that the first time that they use them is not on a patient. They've got some experience when they go out and they feel fairly comfortable about what it is that they're trying to do. We need to make sure that the competency level is to a certain extent, and our ability to work with students hopefully ensures that competency.